Yes,
Speaker,
Representative.
I rise in support of the amendment.
Yes, please
McDermott.
proceed.
Thank you. Mr. Speaker, First Amendment states, Congress shall make no law respecting an establishment of religion. We do a good job in that regard. Can't even say a prayer at a high school graduation. We're pretty diligent about that. Or prohibiting the free exercise thereof. There's a comma after establishment of religion, comma, or prohibiting the free exercise thereof. Another comma. Means it's an independent thought, Mr. Speaker. This is the First Amendment. It's germane to the bill, trust me. The wall of separation must be high and impenetrable. Mr. Speaker, we're intruding into religious-oriented hospitals or hospitals that operate under religious directives. We're intruding because they offer their services not just to their own believers or their own flock, but to everyone. They're being penalized because they offer care to everyone. If they only offered it to people of their own faith, we wouldn't be having this discussion. But because they open it up as a ministry, we're penalizing them. We're telling them your beliefs don't matter. You're going to hear, Mr. Speaker, that there's 200 Catholic hospitals nationwide that do this. Well, I looked into it. They don't do it because they want to. And I don't even know if the number 200 is right. But I know hospitals in Massachusetts and Wisconsin and Connecticut were victims of their state legislatures, just like we are going to be attacking religious institutions today. And Mr. Speaker, this amendment is good because it's going to disabuse me of this notion. It's going to disabuse me of the notion that we're going after religious-orientated caregivers. Why do I have that notion? The reason I have that notion was Planned Parenthood in their testimony said in 2010 they did a survey. 26 emergency rooms, 23 of them gave emergency contraception. That means there were 3 in 2010 that didn't. 2 of them are now closed. That's 1 hospital in the entire state. And 1 more that might open up. And that's why this measure's here. Because somebody who doesn't even live out there wants to make St. Francis West, which will be the new Queens West, do this. Even though they have covenants with the nuns when they sold them the property or the agreement they entered into that they would abide by Catholic health care directives. So this underlying measure, now, if we pass the amendment, I'm wrong. You've disabused me of the notion. But that is why we need the amendment. Mr. Speaker, if you talk to an ambulance driver, as I did, you ask them, on Oahu anyway, where do you take them? Oh, we take them to Kapiolani. Or Queens Trauma Center, if they've been beaten up and badly abused. Mr. Speaker, this bill is not needed. Currently, based on Planned Parenthood's own testimony, there's only 1 place in this state that doesn't offer it. And we're going to pass a piece of legislation because, damn it, we don't like the way they think. They believe in some fairy dust, some spooky stuff. And Mr. Speaker, it is Catholic doctrine, and I'll speak to it later. Thank you, sir.
Thank you very much, Representative. And